Hi everyone, hopefully you're able to see us and we're in the right orientation. We have accidentally taped these upside down before.
Oh no.
So my name is Dr. Alana for those of you who don't know me, and this is Dr. Kelly.
Hi.
And we really want to introduce Paige Roane. She's a licensed marriage and family therapist, and our topic today is childhood anxiety, because I get asked that question a lot. I mean, I've had 4 children, and I think anxiety is actually something that's very normal. So I mean, that's something that we can discuss. Everyone at some point has anxiety. I don't like to fly, so that sometimes is my anxiety. But everyone has that, and kids go through that as well too. And so we really just want to highlight some of the things that we expect to see in kids that's normal behavior, that's anxiety, and then maybe some of the red flags that says maybe we need some help with this anxiety, or is there something else that's going on that's triggering the anxiety, and maybe things that you can do at home to help get your kiddo out the door to want to even go to school. Because I know that's like a big thing, especially at the beginning of the school year, where kids get really anxious about a new school, or even just going to a different grade, different friends, and all those sorts of things. So I want to thank you for joining us.
Thanks for having me.
I'll tell you a little bit about Paige. She has a bachelor's in communications, so do I, so high five.
Excellent.
In communication studies from NYU, and then she has a master's in marriage and family therapy from the University of Houston, Clear Lake, which is here. And she's currently at the Harris School, and she can probably touch on a little bit about that. And she's also in private practice as a marriage and family therapist, which probably can be quite busy during the entire year.
Yes.
And she also serves as a crisis hotline volunteer for the Houston Area's Women's Center, which is awesome. So thank you for doing that. That's actually a really well needed skill as well. And so we're happy to have her today. She's going to talk to us a little bit about childhood anxiety and give us tips on, really getting those kiddos out the door. We had met several years ago because she came to my daughter's public school in elementary and was talking about some of these issues. And I was there talking about nutrition. And so it was kind of a nice way for us to meet. And so I've always kept that in the back of my mind. And because this is really a big topic that's, I think, near and dear to most of us. So thank you for coming.
Absolutely. Thanks for having me.
Do you want to talk to us a little bit about the Harris School? Because I think most people aren't familiar with it.
Yeah.
And it's a very small school.
It's very small. We're very specialized. So the Harris School is a small nonprofit private school here in Houston. It's just a little bit south of the Galleria. And it's for students whose behaviors have gotten them dismissed from more mainstream school settings. So our ratio for staff to students is 1 to 5. We keep it really small, so that way we can be of the most help to the kiddos. Our focus is getting them back on track socially and emotionally, so that way they can then focus on academics, and they can then mainstream back into whether it's the school they came from, or maybe it's a different school that is a little bit better of a fit for them than their previous school.
Right.
Average length of stay at our school, at the Harris School, is only 2 to 3 years. So the game plan is not to transfer to us and stay there indefinitely, although we've had families who stay. We are pre-K 3 through 6th grade. We've had families who stay a longer time than maybe that 2 or 3 years for different reasons. But 2 to 3 years, average length of stay, and then we help the families and the child transition into a more typical setting.
And what was unique when you told me about it was that the family's required to have therapy once a week with you.
Right, either myself or the other family consultant. Part of our program is that they, parents or caregivers, some children live with grandparents, are required as part of our program to meet with us on a weekly basis, so that way we can touch base on what's happening at home, what are the adults seeing, and then what are we seeing at school, and how can we all work together as a team. We're very collaborative. How can we work together as a team to really help the child? Because 1 hour a week in counseling is not going to make or break something. It takes a village, and it takes the work outside of the counseling room or outside of a school setting to also make a difference.
Right, which is why I think family therapy is what's important, is that it's really the whole family, because if you just try to do therapy to a child, half the time it's really the parents who really also need a lot of this input, and because it's a whole family dynamic.
Absolutely. Well, and parenting is hard, and so parents need support, and I think
it's not that hard. Yeah, no, it's super hard.
It's very hard.
and I think that as a society, especially in this day and age with social media, there's this tendency to put a veil over what's really happening. I'm sure you guys have seen it too. You've got a friend who's going through something, and then the next post you see is all smiles, and you're thinking, there's a disconnect here. And so helping families to really get down to the core of things, but also realize that there's support out there and other families are going through it. One of the things I wanted to touch on today is a parenting support group. If you don't have one or know of one, it's okay to start one.
Yeah. We've talked about having one because I feel like so many times parents come in and they kind of go through this litany of complaints about, say, their toddler, and I listen, and I say, okay, do you know what the problem is? And they're like, it's me. And I was like, yeah, it's actually you. It's the kiddo's fine. It's just how you're reacting to everything is really what's driving a lot of the problems.
Sure, and that absolutely happens.
And some parents like have that, they get it, but some really kind of need a little bit of push to see that it's a little bit of a family thing and not just me, the child.
Yeah, and a lot of times, that can be hard. To have to look in that mirror and go, oh, that thing that I do when my kid does that other thing is not helping. Right. So but we get into these patterns and these grooves, and it's hard to get out of them. And we get stuck, and some of it may come from our own families when we were growing up, and things that my parents did that I'm never going to do. And then we do them.
Exactly. So parent support group, if you're interested in one, let us know, because we've definitely something that we've talked about, and I feel like every few months I'm like, we really need to start that parent support group. It's like almost Alcoholics Anonymous for parents. We'll call it Parents Anonymous.
Parents Anonymous. You don't have to give your name.
It's a 12-step program.
And part of the Harris School program is that we do offer a weekly parent support group for the families that are enrolled, for the parents to get together and support each other, hear each other out, have kind of a common space that they can share.
Right, because it turns out most of you are going through all the same things. I mean, when I hear these stories over and over and over, it's literally I'm hearing the same story. Yeah. It's just a different person in front of me telling the story. And while each situation might be unique, they all have the same underlying theme.
Sure, absolutely.
So what I wanted to start with is, and if you have any comments or questions, please throw them out there, but for children at least, like the signs of anxiety. I mean, we know the medical signs of like panic attacks. I mean, as physicians, which is obviously, you get that fight or flight response and your heart starts racing, like, before a speaking engagement or before flying or, whatever you have to speak, where, your heart starts racing and, your eyes dilate. And, so we know that medical response. Some people even get chest pain. I mean, many people think they're having a heart attack if they're at least older adults and get bad anxiety, but in kids it really doesn't really manifest that way. And so, and I'm sure you see this a lot, and a lot of times medically it's kind of the chronic tummy ache. So a real classic one is their tummy hurts all the time.
Yep. But
it seems to hurt mostly when they're headed to school. It doesn't seem to hurt much on the weekend or during the summer or doing something fun. And so, but talk about some of the things that y'all look for, or that you kind of tell parents look for with signs of anxiety in little kids.
Absolutely. Well, and I think, for everybody watching, that I wanted to share my philosophy initially before we even get into that, and it's that kids do well if they can. And I borrowed that from Ross Greene and Stuart Avalon, and it's true, because if you think about we are all creatures, and for kids, they rely heavily on adults, which is why they tend to try to please adults, because in terms of like evolution, not pleasing us means that we're going to reject them, which would then mean that they're on their own and have to fend for themselves. So when you think about it in that regard, it makes complete sense. Kids do well if they can, but it's the if they can piece that sometimes is a holdup for them. And they crave connection, but they settle for attention. And I think that's really important because, again, in this day and age, we tend to put Band-Aids on things and provide attention in different ways, but not necessarily connection. So your question with regard to what to look for some of those signs. So you've got the expected ones: crying, they're tearful, whether it's right before they head to school or just the thought of going to school.
Or even to go to bed because they don't want to wake up the next morning.
Right.
And I know people who have jobs they hate going to bed because they have to wake up the next morning.
Yeah, it's that Sunday, Monday blues feeling. Fearful body language is another one that is, again, a little bit more obvious. The clinginess. Now, whether that's you can't get them out of the house, can't get them in the car, or can't get them out of the car or into the school building, it can manifest in different areas. The big eyes, almost deer in the headlights look. Raised eyebrows, like they're surprised, or furrowed eyebrows, like, I'm not going to do this. Shaking their head, and then sometimes you'll see it escalate. Think about like a lion that's backed into a corner. the growling, biting, kicking, hitting, things like that, because they are doing anything to avoid that discomfort of what's causing them anxiety. And anxiety is worry, plain and simple. Now, when it becomes problematic is when the level of worry exceeds the ability to cope. And we'll talk about coping skills as well, but I think that's a really important distinction. And I can go ahead and talk about like the overlooked signs.
Yeah, sure.
Okay.
Because I think we do. There's a lot of things that we miss. That
Absolutely.
It turns out is just them having some anxiety.
Sure. So learned helplessness is one of them. I can't do it. Oh no, I don't know how. And you're thinking, no, you know how to tie your shoe. I've seen you do this right before you run outside, but I all of a sudden can't tie my shoe before we go to school. Things like that. Being silly, and some of what I've intermixed in here is not just what parents might see, but also what might be reported to them from teachers, because teachers are with your kids 8+ hours a day, and so they're going to see different things, and it's hard to not take it personally. My child wouldn't do that, but if you can, try best you can to take a step back and know that it's not about your parenting. It's not that you're a bad parent. It's that something isn't working. Let's just figure out what that is so we can all work together to make some tweaks and then move forward and have some progress.
Right.
So like silliness, whether that's at home, class clown, being destructive, and the thought process there, not that this is really a conscious thought for the kiddos, but getting in trouble is better than that thing that causes me discomfort, the anxiety.
Right.
And so that's deflecting the attention. Sometimes it may be outbursts or inattention or daydreaming, which can look like ADHD a lot, but sometimes it's really anxiety. Think about whenever you're trying to do work.
Yeah, but at the same time, I think sometimes they can also have a learning difference or something like an ADD, ADHD, and it's the fact that they can't focus that causes them anxiety.
Absolutely, it's
so
chicken or the egg.
Yeah, those two things really go hand in hand, where we see a lot of kids who have attention, because then they have poor grades because they can't focus, and then they get anxiety about going to school because they feel like they're not performing as well as their peers or their brothers and sisters.
Oh, definitely. And I'm glad that you mentioned that, because I have that a little later on the list as well. You can't make me. Put your clothes on. You can't make me. Okay, I mean, technically we could, but technically they could also just take them off. So, refusing to get in or out of the car, the building, like I mentioned, which, looking at that, sometimes can be diagnosed appropriately or misappropriately as ODD, oppositional defiant disorder.
Right.
Another one, undersleeping or oversleeping, which can also be a sign of feeling depressed. But in this regard, with respect to anxiety, maybe it's that the worry at night is keeping them up, and so they don't want to go to sleep, or they're sleeping in excess in an attempt to avoid, again, whatever the thing is that's causing them anxiety. In this case, school or performance. Stalling in the mornings.
Yeah, well, I think stalling seems to be a normal tactic for most
For a lot of people, yes.
The classic procrastinator starts young.
Absolutely. And I think it's key to also remember and remind folks that kids aren't mini adults. They're not Shrinkadinks from the 80s.
Yeah.
They're still growing and developing. Their brains, the logical part of their brain, does not fully develop until 25. So they are reacting. Yeah, sorry, 25, not 18.
Maybe longer for men.
Also true. In which case, they're reacting from a very emotional, primitive part of their brain.
A lot of the time.
Oh yeah, absolutely.
Yeah.
And you think, what are you doing right now? Because it makes no logical sense.
But it's funny because I always see it like, this happened before, it's like, why is he doing that? And my answer is always like, because he's 5.
Absolutely.
I think he's just being 5. I know. That's what they do.
That component is definitely in there.
Right.
You mentioned the somatic complaints, the tummy ache, headaches also.
Yeah. Sore throat.
We've seen it to the point where children throw up. They get so worked up that they vomit. But what happens typically in a public school when someone throws up? They go home.
Staying home.
Yeah.
So,
or even the kid who goes to school nurse over and over and over and over, a little kind of hypochondriac. And so it could be that maybe there's a reason.
Yeah, there's something else underlying it. And you always want to rule out anything medical.
Of course.
Right.
But, you know, sometimes it may be something that isn't medical.
Right.
And then pieces that teachers or, you know, principals or school nurse may report, things like trouble answering questions in class, or not turning in homework, not doing homework. I don't want to do it and get the answer wrong, so I'd rather just not do it.
Right.
Avoiding group socialization at school, so like avoiding the cafeteria, avoiding recess, you know, trying to kind of isolate themselves, not making eye contact with the teacher. I like to use a rule of thumb: lion, possum, or deer. When you see some of these behaviors, is it a lion? Are they backed into a corner and you're seeing the growling and the snarling and really it's fear? Or, which is the fight? You've got the flight, which is the deer, like, oh, heck no, I'm getting out of here, and they bolt.
Right.
Or you've got the possum. Maybe they just won't notice.
Sleep all the time.
Yeah, sleep all the time. You ask a question, I don't know. And sometimes that is their genuine answer. They're not trying to be defiant. They don't know why they did something whenever they're calm and regulated.
Right.
Kind of like as adults, sometimes we will, in the heat of a moment, say something, or Houston traffic. We might throw a hand gesture. And then after the fact, we go, shouldn't have done that.
We highly recommend you don't do that.
Yeah, exactly. Not in Houston. So yeah, lion, possum, or deer.
Okay, I like that one. That one's good.
So those are kind of the bigger ones to keep an eye out for or ask teachers about.
Yeah.
To see if there's something that maybe looks like ADHD, ODD.
Right.
You know.
And then some of these things go hand in hand. Like you can have two. I mean,
yeah,
you definitely have kids who have ADD or ADHD who have anxiety now, but the question is, like, back to the chicken or egg, is it the ADD that's really fueling that anxiety? And then once they can focus, then they don't have nearly the anxiety because now they can do their schoolwork and make good grades and do those things.
Right.
Or vice versa. Is their anxiety causing them to not be focused because they are just so anxious that they can't pay attention kind of to what's going on?
Absolutely.
So that's why I think it does come in handy to be able to, you know, find or talk to a therapist or even have a psychological evaluation so that you can kind of tease these out, because even depression can really, and you know, and I think that the thing that we don't appreciate is, you know, we see kids all the time for colds and flu and all this sort of stuff, but even when kids come in for regular things like that, in the back of my head I'm always like, so how's school going? And sometimes parents are like, well, he has a cold. I'm like, yeah, but how's school going? Because I think that we, at every visit, do need to think about, like, the mental aspect too, because it's a pretty big part of your global health, which is your mental health.
Absolutely. Your brain runs the show.
And the rates of anxiety and depression in little kids is actually pretty impressively high. It's not low. And so if you're at any point, I think, thinking, does my kid have depression and anxiety? They probably do.
Yeah, and not that that's something that necessarily crosses a lot of parents' minds, because, like you say, it's what's the presenting issue? What's in front of me? Oh, it's a stomach ache. Okay, let's get you Pepto, some crackers, some Sprite, lay down. Oh, that's interesting. It happens every Monday at noon. What's going on there?
Right.
And so it's really starting to look for those patterns, and again, relying on the other people that interact with your child, sports coaches, you know, again, teachers, to give that feedback, and then being open to that feedback, because sometimes feedback is hard to hear because we tend to take it personally.
Right, yeah, and I think that's true. I think that parents feel
judged.
Oh,
and
guilty.
And I hate, I don't know, I don't believe in mom guilt. I always say that, like, I just don't understand it. You know, it's like, you know, it's your child, and everyone raises them a little bit different, and there's no perfect way, and so everyone should do what works for them, and then be open to help, and just recognize that, you know, some kids may seem like they need no help. I think at some point in everyone's life, they need some sort of help.
Yes.
Because there's always situational anxiety or situational things that happen too, and I think that, you know, it's dangerous to also ignore that.
Trying to operate in a silo isn't helpful.
We need to be in a culture where we can talk about these things and be open to hearing people's problems. I think that we all kind of, like you said earlier, put a face on and say, oh, everything's fine, when really, you should be saying, you know, I think my kid's struggling with this and I need help, you know, and find those safe people that you can talk to about it.
Absolutely.
Yeah, for sure.
Absolutely.
So what can they do, and I know you have a list of this, I'm glad I see it, but so what can parents do, especially when they're in the moment? I do think that the lion one is really difficult.
Mm-hmm.
So when the kiddo's being suddenly real combative because they won't put their shoes on, they won't do this, they won't do that, and they won't get in the car, and you're like trying to drag them out of the car at school. I mean, this actually happens, and it's tough, right?
And it can be embarrassing for parents too, and they're thinking, I've got to get to work. Like, get out of the car.
Yeah.
Absolutely.
And so what can they do? What are some tips they can do for in the moment?
Yeah, so in the moment, as adults, we tend to say things like, it's okay, don't worry, or let's come up with a plan. Remember, they're operating from that really primitive part of the brain that is only able to respond to feelings and connection. Mm-hmm. So saying it's okay, the kid's thinking, no, it's not okay. If it were okay, this wouldn't be happening. Or let's come up with a plan. Hold that, it's not bad, but hold it until they are in a calmer place. So in the moment, meet feelings with feelings. Validate. So you can guess and guess wrong on the feeling. Your child's, screaming and yelling, and lowering your voice in that moment is going to be really important, because for them to try and hear anything, they're wanting that connection, but to hear anything, they then have to stop what they're doing. Meeting their screams with your screams is co-dysregulation. It just escalates, and it's fuel to the fire. You're nodding your head.
I may have a 5-year-old and a 2-year-old that may need these things. Yeah.
There you go. So validate. If you guess the feeling wrong, 9 times out of 10, the kid's gonna tell you, oh, you are so mad that I've asked you to put your shoes on. No, I don't want to go to school. Oh, okay, thank you. Or, and then coming to find out that someone made fun of those shoes and now they're furious and they don't want to wear them. But if you guess the feeling and you guess wrong, it's better than not guessing the feeling at all. And even when you may not fully get it, trying to keep in mind that they live in kid world. We live in adult world. And just because kid worries are not the same as adult worries doesn't make them any less real for them. So you may not get it, that's okay. The goal is just that empathy.
What do you think about giving them a hug during that time?
It depends. If they are offering a hug, works. Some people don't like hugs, even children. I am a hug person, so that for me is difficult. Just to mentally digest, I'm like, you don't want a hug, but some people don't. That's just not their jam.
Yes, and I think that's actually really important, because having had 4 kids, I can tell you, some were huggers and some weren't real huggers. And don't try to hug the non-hugger.
Yeah, that'll shoot them up.
Yeah, that doesn't work very well.
Yeah, they almost feel trapped in that moment, and now they're fighting.
Right.
But so easy talking in that moment. Lower your volume, lower your pace as best you can. Try and stay calm, because they are feeling completely out of sorts emotionally, and so they're looking at you to mirror how they ideally could be acting and controlling themselves. So your volume, your pace, your tone, when anybody is in that part of their brain, and that's the lower part that is the one that is running the show, simple sentences are best, because trying to have a long conversation, the first 3 words might be heard and then they're done. So
no complex sentences.
No complex. Meeting, feeling, validating, and easy talking.
Easy vocabulary.
Yeah. 2 best things that you can do in that moment. Now, that's not to say that you completely ignore what happened and go about the day. It may be that hours later, when they're calm and disconnected from the event. So their body might look calm, but then you bring it up and they shoot up again. We're all human. It happens to all of us. Like, why are you making me talk about that type of situation? So hours later, next day, bringing it up, normalizing to the kid that everybody has worries. And one of the great ways that adults can do that is modeling when they have a worry. Talk out loud about how you're coping with it. Oh man, looks like it's raining outside. I'm worried that our power might go off, but that's okay. We've got candles and we've got flashlights. And it sounds really rudimentary and really elementary as we're saying it from adult to adult, but for kids, even if they're not engaged in the conversation necessarily, they're so observant. They're little sponges. We all know this.
Yeah.
As soon as somebody swears and then they swear, you go, ooh, didn't think you heard that. So they're noticing all of these things. And so talking through how you handle it and that you have a worry, because kids don't realize that adults have worries too, can be really helpful for them. And then connecting. Again, social media can be great for things like this, but a lot of us get really engaged in our phone and we forget to engage with the people around us. And so 10 to 15 minutes a day, one-on-one time with the kiddo, zero electronics. No TV, no video game, no phone, whether that's, oh, we're gonna go to the park in Houston and it's 7,000 degrees outside and I'm just gonna sweat with them. But being in their world for those 15 minutes, because for the rest of the 23 hours and 45 minutes of the day, they live in our world.
Yeah. And I think there's 24 hours in a day, and we can probably do better than 15 minutes.
Yeah.
I start with 15. Everybody's schedule's different. Number of children at home is different. 15 is tends to be something that can be consistent from one day to the next. Whereas, oh, today I've got an hour, but tomorrow I only have 15 minutes.
Right.
The consistency is so important to help decrease anxiety.
And can you give us an example of, I mean, you said going to the park, but like really engaging with your child and what sort of conversations you could have, or how you can get into their play instead of, you know, bringing them into your
Great
idea
question.
of play?
Great, yeah, your idea of play. That's a great question. As adults, we tend to interact with children by peppering them with questions. And we don't even realize that we do it until someone points it out. And then we go, geez, I ask more questions than I even wait for the answers to. So, all right, it's 4 o'clock. We're gonna do our special time together. It's all you. And they are coloring. Don't be the weird adult that stands there and just observes the coloring. Get in there, get a piece of paper, color with them. If they're doing a coloring book, you start to color. If they say they're coloring with a blue crayon and they say, I'm gonna color this green, immediately you wanna go, no, that's a blue crayon, and correct them. Oh, you're going to color that blue. And so you can tweak what you say to correct them, so that way they're not being met with no, because kids hear no a lot. They are trying to discover their world, and we're putting boundaries
I hate
up.
the word no.
So and people have to hear it at some point, but there's different ways to go about it for sure. If you're coloring something, they say, oh, let me color that orange. Oh, you want it to be orange, and you color it orange. You're in their world. You do what they want to do. Now, if it's completely outrageous, different story. But they're building something, you're building with them. If they want you to build on top, great. If they don't, and they just want you to build next to them, okay, great. What are you building? Doesn't matter. Don't even bother asking that question. So really, it's watching out for the no, for the use of the word no, and for asking questions, and just being in their world. Tap into your inner child that we left behind so many years ago, and just enjoy playing with them.
Yeah, and like even when my kiddo gets in the car, I only have one left really to get in the car, but instead of ever asking her how was school, I think that's actually the world's worst question. I think it's met with fine.
Good.
Matter of fact, I say, well, how was your day? Fine, good. I mean, no one ever answers that question. So instead we say things like, so what was the best part of your day?
Yep.
And that normally at least gets them, to talk about it. Or sometimes like, what was the worst? What did you hate the most? Because because I think it's also good to recognize that not every day is perfect. And then I find that they open up and talk a lot more.
Yeah.
Instead of yes or no, questions that you can answer yes, no, fine, you can probably just get rid of in daily life.
Yeah, closed-ended questions. Right. Absolutely. And then ongoing, as far as what to do, continuing the empathy versus sympathy. And a lot of times we mix those up. Empathy is connecting to the feeling. Sympathy is pity.
Yeah, no one wants pity.
No. Oh, this really terrible thing happened, etc., at school today. And, oh man, that stinks. Wow, they don't get it. Oh, this terrible thing happened. Man, that must have been disappointing. The kid didn't even say the feeling. You're guessing the feeling. No, I wasn't really disappointed. I was just annoyed. Yeah, being annoyed is no fun. Now they're like, huh, you get me. There's a really good Brene Brown short. It's a cartoon, and it's empathy versus sympathy.
Yes, I've seen it.
It's a really, really good explanation of basically what we just said.
We'll try to attach the link. We're a little bit IT impaired, but we will try.
Structure, I had mentioned it before, structure and predictability can provide a sense of calm. So does organization. You may not be the most organized person. That's okay. Set a phone alarm for that 15-minute playtime.
Yeah. My children were so advanced that they actually set my own iCalendar to pull out lunch, to have lunch with them.
Nice.
So they'd block out my clinic time, so I'd leave on time, or at least Alexia, the younger one, the hugger, and so that, and you know, she'd at least once a month. I mean, it said lunch with Alexis, and then she gave explicit instructions on where to go,
And what she wanted for lunch.
Chick-fil-A, you know, what you wanted, and you better show up on time.
There you go.
So sometimes your kids will do it for you, but let them. So if your kiddo will take the time to go to your iCalendar and block out time for themselves, they probably really want you to show up.
Absolutely. Yeah.
So you just need to figure that out. Yeah.
Yeah. And with how busy everybody is, I know that dinner time has kind of fallen by the wayside for a lot of families. Once a week. One time a week, minimum. If you can do more, great. But if you can't, that's okay. But that one time, especially if it's consistent, like, okay, every Sunday we have dinner together. Odds are you're probably going to be home. Most people need and or want and or like to eat. So making that a habit, so that way the kids know no matter how busy life is, no matter what's going on, I know that I'm going to have time with my family on this day at this time. Experiencing events with your kids rather than videoing the whole thing or capturing it all in photography. Doesn't have to be every time, but ever so often. Oh yeah, I'm just gonna put the phone away and just be. I'm just gonna be with you. And then something that parents can do with their kiddo is, and Pinterest has a ton of ideas for a calm down kit. And some kids may like squishy putty. Other kids don't want like the sensory sensation of it. Okay, fine. Drawing, fidgets, a glitter jar, things like that, because they could take that with them in the car as they're getting worked up on the way to school. Okay, I'm gonna fidget. And some schools are open to the idea of kids having a fidget in the classroom as long as it doesn't become a distraction. And so, you know, if you have a 504 type of plan, you know, modifications at public schools and some private schools too will be accommodating to that, because the goal is to help the kiddo.
Yeah, and a lot of schools even moved to, I know Condit, where Alexia went, where they had seating that was for the kids who were the wigglers. I could have used that. That would have been great. But they kind of just bounce around. So, but their body just needs that. And so trying to deny them, if it's something as simple as that, then sure.
Yeah, what is the system seeking was something that plays in my head quite frequently. And then, how big is my problem? It's a number chart, basically.
I love this question.
I
use it all the time.
And helping kids to understand, like, if they say, my problem is a 4 right now.
And is this out of 5?
Yeah, let's say it's out of 5. In an adult world, you're going, it's a 1.
Maybe -1.
Yeah, exactly. Not negating that they have it as a 4, helping them validate first, and then helping them walk through, okay, well, what makes it a 4? What could make it a 3? And then helping them figure out the pieces that they do have control over to make it a 3. What would bring it down to a 2? Oh, playing some music while you're squishing your fidget, something like that, so that way they can start to see. Again, it's along the lines of talking through your own worry and how you're going to, you know, take control of that situation.
And even with like 2-year-olds who have no idea of scale, you can say, is this a big problem or is this a little problem? And they can start to think about,
give them some examples of big problems. That helps.
Kid examples.
Yes.
Not paying the light bill. Kids don't care about that. They really don't. But even whenever a child is starting to get worked up, if they're already familiar with the how big is my problem, and you can ask the question, and they might be able to give you a number on their fingers, as opposed to being able to verbalize it, because once, you know, that's a higher thinking part of the brain. So once we start getting into fear mode, the logic starts to shut down, the being able to speak starts to shut down, all of that, as I stutter over that. But then, you know, as far as if something's going on with your kiddo and you're really having a hard time pinpointing it, you're not sure, is it ADHD, is it ODD, is it anxiety, is there something else happening, talk about it with your pediatrician. Your pediatricians are going to be your first line of defense with helping your kiddos. You know, ask the teacher for feedback and be open to it. Form that parenting group if at all possible. And then seek out a counselor. Your pediatricians might know a counselor. You may have
lots of them.
You may have friends who either have counselor friends or they know of counselors because of different connections. There's also goodtherapy.org, which is a really nice resource because you can tailor, okay, I want a female, I want, or a male, I want someone who works with children, I want, you know, someone who takes this insurance, or whatever your parameters are, and then it can narrow it down for you within a certain proximity to your zip code.
Right, and because I think it is hard to find the right counselor, and sometimes it is a little bit of trial and error, and don't be afraid to, sometimes you reach out to the first one and they're not a right fit for your family, then that's okay, because you'll find someone who is the right fit. Because, you know, just like, and I also feel the same way about schools. Sometimes kids end up in the school and I'm like, I'm not sure that's the right fit for that particular child. Tell me more about why you chose that particular school. And the other thing I really tell parents, or I ask kids a lot, just when they are having anxiety, is to make sure that there's no one maybe at school themselves, like a bully or someone who's triggering their fear or their worry about even going to school.
Yeah.
And so sometimes, and then I think it's hard because I think there's so many really good schools, and parents have this ideal of one particular school that's, you know, has this big building and it's awesome and it's well known and it's super expensive and, you know, that's great and they have all these resources, it's awesome, but it doesn't mean it's the right fit for them. And it could be that it's this other smaller school that's completely different and doesn't have nearly those resources, but it's the right.
To reach out to a counselor and establish a relationship. A lot of clinicians will offer like a phone consult for free. I do that. So reaching out and just starting to establish a relationship, even having them meet your kiddo one time, so that way that relationship is already started. So if and when problems arise, they're not going to someone brand new. They go, oh yeah, I remember her, or I remember him, type of thing. Like you wouldn't wait and you wouldn't have a newborn and then wait until they're sick to come to the pediatrician.
We really didn't want you to do that.
I do
In fact, I would say the vast majority of our patients, we meet them before we ever, you know, meet. Sometimes they bring their children, but you know, we do see them normally before a baby's born, or they still come in and visit us before they even have a first visit. Because I think even finding medical providers, it's important to find the right fit for your family.
Absolutely.
So, you know, it could be a great fit or it could be a not great fit.
Yeah.
So everyone's different from that aspect. How do you know when to say, I think we need a psychiatrist?
That's a good question.
It's a hard one.
That is a hard one. It depends on what's going on. Some families are open to the idea of like a pharmacological intervention, and some don't, and they don't want to go that route, and that's okay. It's whatever works for your family.
But maybe self-harm.
Self-harm. If you've been working with a counselor and you feel like it is a good fit, but that for one reason or another they're not moving, the needle isn't moving, talking about it with them, you know, for referrals, talking about it with your pediatrician for referrals, and really gauging what you think could be the most helpful for your kiddo. Sometimes medication is needed to get over a hurdle, and then we start backing off the meds.
Yeah, and I think it's important to know, because sometimes parents do end up taking their children to a psychiatrist, but it doesn't mean that they actually end up starting a medicine.
No, and sometimes it could be a little more exploratory.
Right. And so, or it could be, you know, changing the type of therapy they get, but it's not necessarily medical therapy.
Yeah.
I always have to put in my 2 cents on nutrition and diet.
Yes.
I actually do think you are what you eat. So, historically, I have found more problems with the kiddos who have that super limited one color diet. It's usually white or yellow, because it's the color of like chicken tenders,
mac and cheese,
mashed potatoes, bread.
French fries.
I mean, it's just French fries. And so it turns out, you know, to get all the nutrients you need, they're super important. You know, we know
the rainbow
truly is kind of a colorful. Like if your kiddos' meals are always the same color, then you know that's all other things. And the other thing I always just put my 2 cents on is adequate sleep.
Sleep is so important.
Sometimes kids, and it turns out that's why it is important to talk to your pediatrician, have like obstructive sleep apnea, and it turns out, or they have restless leg syndrome, or it turns out they're just not sleeping. And you think they're sleeping, but they are not sleeping. And so a lot of their, whether it ends up being depression or focus issues or anxiety or something else, or just a kid who's just on fumes all the time because they actually have something medically causing them not to sleep.
Yeah.
So that's why it's important to talk to your pediatrician. Obviously, if you're our patient, talk to us. But we do want those kids to get out the door. We want them to be in the right school for them.
Definitely.
And to be open to that, but to not be afraid to get help. So we have a lot of, our whole building is filled actually with psychologists and psychiatrists, it turns out. But there's lots of help that's out there, and there's even lots of really affordable help, and there are organizations that are nonprofits that also offer that help. And because I really feel like it should be kind of a global thing, and not very accessible.
Yeah. Well,
and then take advantage of your school, because they have help too.
Well, and to your point about the nutrition, sometimes I've heard parents say, my kid's a picky eater, and so that's why they default to the chicken nuggets and things like that. But sometimes that can also actually be a sensory issue with the food, and OTs, occupational therapists, can help with that, which I find fascinating. That's not my specialty, but I do think it can be helpful for parents to know that that's available.
Yeah, and I think that's why it's important to, even if you're at a visit and you're complaining about your child has one particular complaint, but in the back of your head you're worried about his attention or focus or anxiety or something else, bring it up. And even if your pediatrician doesn't have time right that minute, it'll be like, hey, let's make an appointment and actually block out 30 minutes or 45 minutes to really delve into this issue so you get the help you need. Don't let small problems in the family start to become really big problems to that now you're kicked out of school or, and that does happen. And so you really want to, as soon as you see an issue, say, what changes can we make? Because for the most part, doing nothing usually doesn't work. And I would say that's true for almost anything in life. Staying the course of things when you can tell they're not going right just leads them to continue not going right and go worse.
Yeah.
And we don't want that for the kiddos. We definitely don't want that for ourselves.
No, or for parents.
Yeah.
Your job's hard enough.
So I guess our conclusion is parenting harder than it sounded.
Yeah, there's not a book for it.
Yeah, I do believe in the positive reinforcement. I don't believe in rewarding your kids with food. And I will say the 15 minutes of time, which I would love to be more than 15 minutes of time per day that you're going to dedicate to your child, don't make it every single time getting ice cream.
No.
It's not, don't use it as a time to do a reward for them. Instead, use the time to actually be with them and do something that has nothing to do with shopping or Starbucks. My daughter would just ask for Starbucks every time, but so think about those things, and then I do agree with the phone free, trying to take time out of your life to just put it away and take that picture in your head.
Yeah, absolutely. Well, and you make a good point. Analog play, that's really the goal of that connection and special time, not rewarding it with food or
electronics.
Yeah, or electronics, but also don't make it based on, oh, well, you didn't make your bed, so we're not going to do this. Special time is consistent. It happens. It's because they are worthy of love and time and connection, not because they did or didn't do a certain behavior earlier.
Right. It's just like dinner time. Dinner time is, negative talk is off the table. It is a safe time where no one's going to ask you about your grades, no one's going to ask you about your test. No one's gonna, say, why'd you make a 75 on that math homework, even though those questions are all in our heads. But we keep them in so that they know that when they're at dinner, it's like their free time. And then I even read this once, and we try to practice this at home now because my husband, who's not watching because he doesn't have Facebook, so I'm gonna throw him under the bus. But after every soccer game, we'd get in the car, and all he'd want to do was talk about the game. And I'm like, that seems so bad. And so I finally sent him an article that was like, do not talk about the game and in the car on the way home, because most kids don't actually want to talk about it. Instead, say, hey, that was awesome, you got popsicles, or say something else that's completely different. It has nothing to do with the game, because they need to digest what happened too, because a lot of times you won't talk about it because it went poorly.
Sure.
So save that kind of stuff. Like, they need some time to be just kids and be protected and not always kind of critiqued, if that makes sense. Dinner time, and then after game in the car time. So our daughter knows this rule, and so she will call us out on it if we actually talk about the soccer game or the volleyball game in the car. So maybe you can tell your kids and they'll call you out on it, and that usually straightens up us really quick.
Sure, yeah. Well, and you make a good point there, because as the adults, our jobs are to help the children become functional adults. But also, kids can be helpful to us too. So we're keeping them in check and helping them learn to keep themselves in check, but they're doing the same for us, or they can if we allow it. And so just being open to that, I think is important.
So kids do well if they can, and adults do well if we let the kids let us. All right, so we seem to follow some good advice. All right, well, hopefully that was helpful. It's a lot of H's.
It is.
So thank you once again, Paige, Roane,
Thank you.
and with the hair school, and then Dr. Kelly and myself. So if you have questions, let us know. Hit up your pediatrician also for more advice, and thanks for joining us. Bye.